Hello everyone, how are you today? My name is Elizabeth Willett, Senior Herbalist with the Natural Fertility Company. We are the naturalfertilityshop.com and naturalfertilityinfo.com, a team of women who have a variety of different specialties and expertises, I guess I should say, I don't know how you say that, plural, who are here to help couples on their journey to pregnancy or to overcome natural fertility issues. So hello and welcome. I was going to come to you with another herb, but it super rained here last night. Tons of rain. We're flooded. My yard is flooded. Our pool is flooded. The town is flooded. My husband's school is closed today because of too much rain in the town where he teaches. And so I really can't go out and get plants in my neighborhood today. So I'm going to talk about premenopause. I figured that this is a topic that a lot of you have thought about or heard about, and so hello. I wanted to talk to you about premenopause, what it means, and what you can do about it. So I have a little imagine this scenario to talk to you about, and I do have notes. I wanted to be sure that I was speaking correctly and covering this topic real thoroughly. So imagine this. You've been trying to conceive for a really long time, many months or years, and it's not happening. So you call your doctor and he or she says, come on in, we'll do some blood work, we'll see where your hormone levels are at, we'll take a look at your reproductive system, we'll just check things out. So you have that blood work. A few weeks later you get a call saying, come on back in, we'll talk about your blood work. You go back in, you're sitting there, your doctor's just talking to you about what all these numbers mean, saying terms you don't understand, giving you acronyms for hormones that you have no idea what they mean, and all of a sudden you hear the word menopause. And your brain basically shuts your ears off, and all you can think about is, what? What did I just hear? I'm not old enough to hear that word. What's going on? And you basically forget the rest of the conversation. I'm sure that that scenario is really real for a lot of you, and I'm sorry you've had to hear that, but what I'm here to tell you, and I want to make it known, is that it's not a natural part of healthy aging to be completely in menopause when you're in your 30s or early, even to mid-40s. In fact, many healthy women don't naturally begin menopause until they're in their early 50s. So while you have that blood work and you're sitting there and you hear the word menopause, it's probably not a natural part of an aging process. What it means is that there you have a hormonal imbalance. There's something going wrong. There's something kind of out of whack. Hormone tests that reveal early menopause or menopausal levels when you're in your 30s or 40s simply indicate hormonal balance, or that that's some fertility health issue that you need to find out about and then address. So the hormone imbalance can be from a number of things. You've heard Heather talk before about hormonal imbalance, but I'll just cover some common things that can impact hormone balance. Dietary deficiencies, being overweight or underweight, excessively exercising, yes, there is such a thing as too much exercise. High levels of stress, specifically chronic stress, if it's something you've been dealing with for years and you're not managing, that can impact hormone balance. An underlying health issue with your pituitary gland, your thyroid, your adrenals, ovarian development when you were young, something you would never know was going on unless you had testing. A fertility health issue, I don't think I need to tell you about those, but PCOS, endometriosis, ovarian cysts, uterine fibroids, the list could go on, you know that. Premature menopause, which I'm going to talk about a little bit later, and then the natural transition into and through perimenopause. So the majority of the above cases, the things that I just mentioned to you, do not indicate your days of conceiving a child or being able to conceive a child are over. The only exception to that is possibly premature menopause. So let me reiterate that. I want you to know, if you've sat in your doctor's office and you're 31, 35, 41, 45, maybe even 47, and you've heard the word menopause and you're freaking out, it's not an end-all, be-all diagnosis. It hasn't taken away your chances completely, but it means that there's some work to be done. So, what exactly are premenopause, perimenopause, and menopause? You can find this information online, but I'm just going to sum it up here for you. Premenopause, perimenopause, say that 10 times fast, and menopause are actually all natural, very normal transitions in infertility health for women. We go through them, some of us earlier than others, but mostly in midlife. So late 40s, early 50s. Each stage is a stage in which hormone levels gradually begin to shift, and that happens differently for everybody. Just know that. Not every woman will be instantly in perimenopause or menopause when she enters her mid-40s, but for some of us it happens earlier than others. And then premenopause. Okay, so this is a term that's really loosely used to cover the whole time frame. Premenopause can be, premenopause can be perimenopause and menopause. Doctors use this term really loosely. It can be any amount of time when you are considered, advanced maternal age. I'm really not a fan of that term. But anytime when you enter your mid-30s, roughly, all the way to early 50s, where you could be potentially in perimenopause or menopause. Women can still have their periods. It can be totally normal. You may not even know that you're in premenopause, but oftentimes the indicator that this is happening is that periods become cycles and periods become irregular. So cycle length typically gets longer and periods change, and cervical mucus may decrease. This is also a time when women start to notice some very unwelcome symptoms. You may have had some of these before, but things like hot flashes and night sweats and insomnia, anxiety, depression, heart palpitations, lack of libido and sex drive, you just don't want to do it. Vaginal dryness, which of course contributes to lack of libido, weight gain, temporary difficulties concentrating, breast tenderness, swelling and water retention, headaches, joint aches and pain. So doctors look at all of these symptoms when they're also evaluating your hormone levels in terms of age too, to determine if you're in this premenopausal stage. So now perimenopause. Perimenopause can span it can be a long time, frankly. It can span several months, up to 10 years for some women. This is before a woman enters menopause, when her ovaries slowly begin to produce less estrogen and sex hormones. Perimenopause can begin in the late 30s, but typically we see it and doctors can diagnose it in the late 40s to early 50s. It is also possible for a woman's hormones to fluctuate in perimenopause and in and out of a perimenopausal state repeatedly during that time frame that you're in perimenopause, which means you may have several months of completely normal cycles, miss a period, or have it change completely and then have it go back to what seems like normal, which makes this time period really, really strange and frustrating. And then menopause. Menopause, we probably all know this, but it's a stage in life when the woman's body stops producing enough estrogen to ovulate and menstruation stops. Now, natural menopause can be officially diagnosed when a woman is in her late 40s and early 50s and hasn't had a period for 12 months consecutively. So yeah, back to that premature menopause portion I mentioned a little bit earlier. So it's not common at all for women to go into premature menopause, but it can happen for women who have surgical procedures for fertility health issues, procedures like uterine fibroid embolization or hysterectomy, of course, and that can even be if the ovaries are left behind. And premature menopause can happen if there's ovarian damage. That can be from a surgery, it can be from fibrin or scar tissue formation, endometriosis, large cysts, especially if they burst, things like that. So premature was that one exception when I said earlier in my scope or my talk about how these stages of life aren't your end-all be-all, but premature menopause as a result of a surgical procedure to remove your uterus and ovaries, or to embolize or for that uterine fibroid embolization can put you into premature menopause. And at that point, natural conception or even conception with medical fertility procedures is going to be probably a little bit more challenging. So that would be the one exception. So now, enough of the what it is, what this all means, and what do you do about it? So you sat in your doctor's office, you heard the word menopause, you don't exactly know what that means, you're too young to be there though, so what do you do now? Your doctor's probably going to suggest some hormones, hormone replacement therapy possibly. Hopefully this day and age someone will mention to you things like diet, beginning to change your diet if you're not already doing that. Heather has reiterated over and over and over the importance of diet, so I'm not going to go there, but I'm going to share with you, because it's true, that diet changes are incredibly important. But what I want you to know is that if you hear that word and you're stuck and you don't know where to go, you need to make yourself a part of your fertility journey. And this actually comes from my herbalist colleagues. We recently talked about how to help women who are in this position and struggling. And one of my herbalist colleagues' suggestions was to make sure you love yourself. Give yourself a break. No matter your age, all the natural therapies you've used, supplements you've taken, how many times you've used an OPK, how often you chart, how many doctors' visits you've been through, all the testings you've had, just don't forget self-care. Don't forget to take time for you to stop. If you're frustrated and you're lost your program for a little while, just pause it and enjoy a food you love, a chocolate bar, take a little trip, do something nice for yourself. Just don't forget about you. Massages, considering counseling, taking a yoga class, doing some exercise that you used to love that you forgot about because all of a sudden you've become consumed by scheduling appointments in your workday, going out to lunch with a trusted friend, reconnecting with your partner if you've lost that in this journey. It can happen, so don't forget you. And next, at this point, it's really important to start enlisting the care of a team. So you've got your doctor. You may have been to a reproductive endocrinologist, and if you haven't, now is probably the time to do some more in-depth testing. I know I just told you to stop. Take a break from that, but consider it, even if it's a month down the road. And also consider an alternative therapy like an acupuncturist or a massage therapist. You could enlist the support of a midwife, certainly your best friend and your partner, and even a counselor or a fertility herbalist if you wanted a more natural approach to fixing your hormonal imbalance. A fertility herbalist could be a part of that team. Your team might be all of these people. They should all know what you're doing and how you're trying to support your body, and it's okay to have both a medical and a natural or several of both of those practitioners on your team. And certainly include symptom relief if you're dealing with any of those awful symptoms that I mentioned. Diet will help. Switching your diet to eating 5 smaller meals a day instead of the 3 that we're so accustomed to doing, and making sure those meals are well balanced. Equal amounts of carbs and protein, healthy carbs, whole grains and things like that, and organic sources of protein or plant protein. Limiting and avoiding alcohol, especially if you're dealing with heart palpitations and insomnia and things like that. Limiting caffeine, and if you choose to consume coffee, only having it in the morning. That should help with sleep issues. Using essential oils for sleep and anxiety and night sweats and things like that. Please quit smoking if you smoke. I say that loosely. I know how hard that is to do. So seek support in doing that if you really are truly wanting to quit. And then certainly create a comfortable sleep environment. And herbs can be helpful for things like supporting libido and boosting libido and sex drive, and increasing cervical mucus production and things like that. So natural therapies, of course. It's going to be most helpful in determining the best natural therapies for you if you work one-on-one with someone at this point. Especially if you are dealing with hormonal imbalance and a fertility health issue. We certainly have lots of guides and can get you the information to empower you and help you be an advocate on your journey, but it most likely is going to be most helpful if you have that one-on-one support. No matter your age, really, we have guides that are helpful. We have a wonderful guide, Preparing for Conception Over 40. The tips are really for anyone, to be honest. If you're 35, you could go to that guide. Achieving Pregnancy During Perimenopause is another guide, and How to Improve Your Egg Health. We have a How to Improve Your Egg Health in 90 Days checklist. So contact us at naturalfertilityshop.com and we can get you links to all of that information. Next, how you support yourself. Please consider all of your options. So while I'm here to try to be positive and let you know that hearing the word menopause is not the end of your journey, when you're in your 30s, 40s, even late 40s, you need to consider all of your options. And I completely understand your dream of having your own children. I want that for you too. But there are both natural and medical ways to help you try to achieve your dream. There are unique options. There's hope. There's all sorts of different things. I'm sure you know them, from having a surrogate to an egg donor to a sperm donor to obviously adoption, things like that. But certainly using what your reproductive endocrinologist and your medical doctors are telling you with natural therapies, hopefully will get you to that dream. So to kind of recap, I guess despite the time frame of pre and perimenopause being considered the end of a woman's reproductive years, which I guess essentially it is when you're getting up to the age of 50, it is not the end. I want you to have hope and trust that it's not the end when you hear that word in the doctor's office. You can still become pregnant in perimenopause and premenopause because ovulation can still happen. It just may take a little bit more work. Now more than ever is the time to enlist natural therapies. Change your diet, boost your egg health, enlist the support of your natural and medical practitioners. Make yourself a team, and don't forget to advocate for yourself on your journey. There's still definitely hope. And then finally, all of that said, I do have to say that if you are the age of 50, you've heard the word perimenopause or menopause, and you still wish to conceive, it really is incredibly important to enlist the help of someone who specializes in working with women who are close to or in menopause. Chances of issues coming up when you're over the age of 50 and over actually, and they just increase. You know, there are chances for, just bizarre things to happen, sadly. And we don't want the health of your health or the health of your baby, should you conceive, to be at jeopardy. And it's really important to work with someone who specializes in working with women in menopause when you're 50 or over. So I hope that I've given you hope if you've heard that word in the doctor's office. We certainly are here to link you to those guides that I mentioned and any information that you need. So if you have any more questions, contact us through the Natural Fertility Shop. Our team has many specialties. We'll get you the information. We'll empower you to make natural health choices. Our customer care team will send you to our herbalists, myself included, and we'll help you out via email, most certainly. So thank you for joining me. I hope you have an awesome day. Please, if you pray, say a little prayer that the rain stops. We're going to need an ark soon here. So anyway, see you next week. Bye.